Folks, good morning. Welcome to our sixth annual Overdose Awareness Series. I'm so excited to be able to say that. My name is Alex Sorotsky. I am a public health educator with the Washington Poison Center. And I've been in this role since 2019, which means I've been in this role since we did our very first Overdose Awareness Series in 2020. This was an idea that started by my good friend and colleague and now my director, Megan King, as a way to connect with Washingtonians during COVID lockdowns and during that isolation. Now, that first year, we reached a few dozen folks, and it's grown so much now that as of this morning, we had over 700 residents for this year's registrants, excuse me, for this year's series. That is so exciting for me to see. On that note, we have plenty of open tickets, so please invite your friends, families, neighbors to join today, to join the rest of the days. We're doing this throughout August. That's every Tuesday in August. Now, I'm personally very honored to be part of something, be part of both the series and part of the Washington Poison Center that continues to grow and adapt to match the needs of Washington residents. Now, before I pass the virtual mic over to Dr. Phillips here, I do want to go through some basic housekeeping for the day. Now, if you're hearing me right now, that means you are logged into Whova correctly. That is excellent. Thank you for doing that. You are going to be muted throughout, so you can speak all you want, but we won't hear you. So please, if you have comments, questions, use the chat box built into Whova, as well as the Q&A box built into Whova. Now, I'll be moderating this opening keynote, and you'll see me and my colleague Justin Mauger pop on throughout the day, moderating various sessions. We will do our best to watch for those questions and comments and address them accordingly. And I do want to acknowledge, for anyone who is curious, we will provide certificates of attendance at the very end of the series. So that's after August 26th. We will send a follow-up session series feedback survey, complete that survey, and we will provide you with that certificate. Now, on the agenda for today, we've got, of course, our opening keynote here with Secretary Dennis Worsham. We're so excited to have him join us. We're going to then have our next session be on crowd control chemical agents. We'll have simultaneous sessions after that on lead poisoning, as well as poisonous and hallucinogenic mushrooms. We'll then have substance use disorders with our very own Dr. Phillips, with a focus on older adults there. Our last two sessions will focus on gas station highs, as well as safer smoking supply distribution in Spokane, Washington. Before I finally turn it over to Dr. Phillips, I do want to thank this year's sponsors and partners. This is the first time we've ever attempted a sponsorship program and partnership program, and we work for Health Washington, the Washington State Department of Health, both their Drug User Health Program and Teen Health Hub, as well as the Washington Healthcare Authority. Now, you didn't log on to hear me go on and on, so I'm going to turn it over to the CEO of the Washington Poison Center, Dr. Scott Phillips. Take it away, Dr. Phillips.
Thank you very much, Alex, and good morning, everyone. Again, my name is Dr. Scott Phillips, and I'm the CEO and the medical director of the Washington Poison Center. And on behalf of more than 40 dedicated staff members, I want to welcome you and thank you for joining us at the 6th annual Overdose Awareness Series hosted here at the Washington Poison Center. I also want to express my gratitude to our incredible staff whose dedication and effort have really made this possible. But I do want to give special thanks to Megan King, our Director of Communications and Outreach. She's really the meeting architect of putting this all together. But fortunately, we have Alex, Justin, Michelle, Anna Maria, Sarah, and many others behind the scenes doing heavy lifting. And of course, I want to thank our superb call center staff who are on the phones right now and day and night, helping to answer those calls that come in. This year, the Washington Poison Center is proud to be in its 69th year of serving the people of Washington. We're a nonprofit organization. We're only one of 2 nonprofit poison centers in the United States, an unusual distinction. We depend on the support of generous individuals, hospitals, the Department of Health, of course, the Healthcare Authority, our partners and communities really to sustain us in our life-saving work. And also, did you know that unintentional overdoses still remains one of the leading causes of death in Washington? That really speaks to our value. So your support helps ensure that expert 24/7 care stays free and accessible to everyone in the state. And to learn about making a contribution, please visit our website at wapc.org. Well, this annual gathering reminds us why we do this work, why we collaborate across disciplines, why we pursue better data, improve systems, and seek better outcomes. You know, we honor lost, we confront stigma, and we try to speed up solutions in the face of this overdose crisis affecting every part of the state. Some parts of the state, it's improving. Other parts of the state, it's not as improving as fast. So our work is certainly not complete. Today, we're joined by clinicians, first responders, public health professionals, social workers, researchers, advocates, community leaders, and many, many more. Each of you on this session and in these ensuing sessions really play a vital role in shaping Washington's response to substance use and poisoning. And this event really highlights your dedication. And we want to thank you, all of you, who have and continue to support our mission through your contributions, time, and dedication. And thank you for keeping our community safe, informed, and cared for. And it's in the same spirit of service and generosity that we begin today by honoring one of our most beloved advocates, someone whose dedication and lasting legacy continue to guide the work we do every day. And this overdose series is dedicated to former Secretary of Health, Mary Selecky. And I want to take a moment to recognize this champion whose leadership laid the foundation for much of the work we do today, both in the Poison Center and throughout health departments across the state. Many of you know Mary, knew that she was a true advocate of public health, not only through her years of service as Washington's Secretary of Health, but through her tireless advocacy for vulnerable communities, her collective spirit, and her unwavering support of the power of prevention. On a more personal level, Mary made her home on the side of a mountain outside of Colville, Washington. But her reach was extensive. Mary was a friend of my family, actually close to my father and to myself, primarily through her service on the Colville Rotary Club. Many may not know that Mary and a local family physician from Colville, Ed Gray, played a key role in establishing the Poison Center as a nonprofit, securing its inclusion in state legislation under Governor Lowry in 1993-94. And so her touch continues in our organization over 30 years later. This was before she became Secretary of Health, when she served as administrator of the Northeast Tri-County Health District for over 20 years, serving Pend Oreille, Stevens, and Ferry County, before moving into a role at the state level. Well, Mary also served on our board of directors for several years and was a dedicated contributor to the organization. She always understood what it means to lead with both compassion and courage. And during her time on the board, she collaborated closely with us to strengthen public health infrastructure, outreach, surveillance, overdose trends, and ensure families receive timely life-saving information and care. Her support helped the Poison Center as a trusted 24/7 frontline responder, not just in emergencies, but really in shaping policy, education, and systems of care. Her legacy lives on the partnership that she built and the people she mentored, and every call answered, every data point reported, and every life touched through our efforts. So this year's lecture series is dedicated to the public health service gifted to us by Mary Selecky. The Poison Center has also awarded her the Distinguished Robertson Award, who was our founding director. In addition, we've established a scholarship fund to support like-minded aspiring students who will follow in her footsteps. To learn more, to make a contribution, you can also visit us at our website at wapc.org. Today's program will carry on in that spirit with a series of talks meant to inspire, to inform, and to challenge us. Whether you're here to share data, learn from colleagues, or honor those lost to overdose, we're glad that you're with us, working to support better the people and communities we care about. So let this day deepen our resolve. Let it be a catalyst for compassion and accountability. And most of all, let it remind us that while the work is hard and deeply human, it's deeply necessary. Looking ahead throughout these sessions, expect clear data, honest discussion, and new ideas that you can apply tomorrow. Yes, the overdose crisis is overwhelming, but together we can replace bleak numbers with real stories of recovery. Sometimes our work may be challenging and we maybe feel tired or down, but our efforts are truly essential. With that, it's now my honor to introduce our keynote speaker, someone whose leadership has been crucial in guiding Washington's public health system through some of its most urgent challenges and opportunities. Secretary Dennis Worsham of the Washington State Department of Health brings to this role 30 years of experience in public health leadership with deep roots in local health jurisdiction, infectious disease, behavioral health integration. Throughout his career, has been recognized for leading with purpose, bridging communities and systems, and listening, truly listening to people that are most affected. As we confront the landscape showed and shaped by the ongoing overdose crisis, increasing polysubstance abuse, and disparities across states, Secretary Worsham has made it clear the Washington Department of Health will address these challenges not only with science and strategy, but also with his characteristics, empathy, equity, and accountability. His appearance here today as our keynote speaker so soon after taking office is an indication of his department's support for the overdose crisis in the Washington Poison Center. And we look forward to continued expansion of our coordinated statewide response to saving lives, including expanding access to naloxone, improving surveillance, and advancing cross-sector collaboration. So today we're honored to have him here with us to help kick off this year's Overdose Awareness Series. So please join me in welcoming Secretary Dennis Worsham. Secretary.
Dr. Phillips, thank you so much for your opening remarks, in particular for your reflections on our former Secretary, Mary Selecky. I'm going to talk a little bit about her this morning as well, as I know this is a special tribute to her as part of today and kicking this off in the funding and the scholarships. But I just want to start with my kudos and my deep appreciation to you and your team who have been public health champions in this space of poison control in our communities, in really around substance use and poisoning in particular. As we talked before the meeting started today, is I think most of my career I have had programs or services that have been directly impacted or partnered or co-created specifically with the center. And we're so grateful that you are here and the services that you provide to our communities and keeping us safe, keeping us healthy, and keeping us in a better place than we would be if you weren't here. So thank you so much for those dedicated services. I want to, today I just want to, as my opening comments here as we start off this overdose series, is talk a little bit about Mary, and since this is part of the tribute to Mary today, as well as introducing a little bit about myself for those who don't know me, and then a call to action for our shared work around preventable deaths, and a bit of information on kind of what I'm seeing as I'm coming into my new role. I'm 4 weeks in and learning lots and lots more to learn. Alex, go ahead and advance the slide. So this is just a collage of pictures of Mary Selecky. For those of you who never knew Mary, she was a force to be reckoned with. A compassionate heart, deeply committed, hard worker. I think you could text her at any point or call her at any point of the day or night, and she would respond. And incredibly compassionate about the people she served with, and the work that we did as a collective system. Mary served as the Secretary of Health from 1999 to 2013, a 14-year stay in her role of exemplary leadership. She was one of the longest secretaries of health in the United States. and well known both nationally and internationally for her work in this particular time that she was in her secretary role. And of course, as we all know, she continued that passion and commitment through her ongoing work after her retirement years. I don't know that she ever fully retired. She just moved to her retirement check and continued to work just as hard. Even in her retirement, I know she served tirelessly on a number of boards, and I know she also served here on the board with the center. Next slide. A couple things as I was thinking about Mary and from a public health perspective of where Mary had lasting impacts, as Dr. Phillips talked about, as she did for the Poison Control Center. She had lasting impacts in a number of areas. And it's interesting, in Mary's passing, I continue to learn about other places where she was a quiet leader, but actually moved great things forward. And I didn't know that she was one of the people who was instrumental in getting this center up and off the ground and started over 30 years ago. So it's I think those stories will continue to be told and shared among all of us in Washington. Some of her areas of passion that she really led with was around smoking rates. She took Washington adult smokers rates from 22% to 15% in her time in her tenure as a Secretary of Health. She was known for her tobacco line, where people could call, get services, the Tobacco Quit line, in order to be able to help people with cessation at no cost, and to be able to support them in their journey of overcoming their addiction to smoking as part of their journey. She had a deep commitment to children and immunizations. When Mary stepped into her role, we were 46th in the nation on childhood immunizations, and 14 years later, at the end of her time as secretary, moved to the 16th position nationally. Huge commitment, dedication, and both policy and funding choices in order to move this work. And the Vaccine for Children program, which assures that all children can have their vaccines regardless of cost or ability to pay. Huge part of the system is the legacy for her that continues to stand up and provides immunizations for children in our communities. As you know, and working closely with us in our public health community, the center has been an integral part of our emergency preparedness and response work as a public health entity. Mary really leaned in and strengthened our public health emergency after the Nisqually earthquake in 2001, and we are grateful for that, and has only continued to grow since her leaving. I think one of our members of our preparedness on the state level, Nate Weed, serves as a non-voting member on your board, and this commitment and intersections with your work is noted. And lastly, at least of the things that I'm talking about her legacies, there's many more, of course. On this slide, I'd like to call out her role in particular of when departments, both state and local health departments, moved to accreditation. Mary led the Washington State Department of Health in becoming one of the first nationally accredited health agencies in the state of Washington, which really talked about her commitment to excellence and accountability to services that every governmental public health agency should be held to. Next slide. I want to talk a little bit about my intersections with Mary early in my career. When I started in my public health journey up in Snohomish County as a HIV health educator and doing work is when I first met Mary when she first came into her role. We had a World AIDS Day and Mary came to speak. And for those who knew Mary, she was an incredible storyteller. And could tell a story in a way that would move hearts and be able to move policy and drive commitment to the work that needed to happen in an emotional way that with intelligence and reducing stigma and access to services was incredibly moving to me as a young professional at the time. A couple things in the HIV arena. I just want to talk about her time that really she played a pivotal role around this emerging disease in the 80s and in the 90s. The state of Washington in 1988 had the first omnibus bill around HIV and AIDS. And this was really a state action where government on the federal level was slow to respond to the AIDS crisis. The state of Washington stepped in with an omnibus that talked about not only how we were going to approach the disease, but also how we were going to treat people who were infected with the disease. During her time as secretary, there came a time in 2002 where the omnibus bill needed to be reviewed and modernized in order to be able to address where the epidemic was at the time. She took that policy review and modernized it in a couple of ways. In a very merry way, went out on a tour of people who were impacted by the disease, people who were affected by losing family members, and advocates across the state of Washington, healthcare providers, to really understand what the new form needed to be in modernizing our work around the HIV and AIDS pieces. She came up with, from her listening tours, 17 recommendations that were really about sustainable funding, education, and care coordination and structural improvements to how we were responding to this deadly disease in Washington. There became a challenge at the time, as it feels really reminiscent in many ways of some of the things that we're seeing at the federal level now. But she came across a very contentious debate really around the governmental public health system wanting to do more around stronger surveillance to better understand how people were becoming infected, who were becoming infected, where they were becoming infected, so we could tailor the right interventions and put the money where it was going to make the greatest impact. While the surveillance wasn't a critical public health intervention, it raised a lot of concern in the community about collection of names, information that could be shared around privacy and around increasing stigma, in particular for our gay and bi communities who are adversely impacted around HIV and AIDS. She took these concerns, found a solution, and was able to move to an incredible process of where we improved both our surveillance, but in a way locked down names and information to the public or through public disclosure in order to be able to reduce stigma and increase privacy around a very sensitive time when homophobia and those living with AIDS had so much stigma. Lastly, in this particular area, I would say that Mary created an overall response to long-term prevention and care strategies. And she did that with a commitment to really a legacy of compassion and strategy that really centered in people with lived experiences and making sure that they had the service and accessible needs that they had in order to be able to meet the challenges and to live a healthy, productive life, and to also address stigma in a real way. Next slide. Lastly, I want to call out one other particular issue that I would say about Mary is that she was a fierce advocate for equity and rural access. As Dr. Phillips mentioned, she had strong roots in Colville, and even as the Secretary of Health living in Olympia, returned back to Colville to stay very connected to her community, in which she felt very part of a family there of members of the local community. I had the opportunity to attend Mary's celebration of life in Colville, and the outpouring of locals and people who she impacted directly were not a surprise to any of us. But the one piece that stood out for me as one thing I didn't know as I continue to learn Mary, even in her death, is she had a group of kids in Colville who are now mostly adults and have children of their own, and they were called Mary's Kids. And Mary wanted to make sure she was a coach, a mentor, and an aunt to these people in really showing up. And each of these kids were there and raised their hands and shared stories about the impacts that Mary had in their lives as a great community member, a friend, and an advocate and a coach. She was also that same voice and consistency around equity and inclusion around the healthcare system and serving underserved populations, and really had this belief that I carry with me in my work, really from an influence with Mary early in my career and working with her, is that every person in every corner of the state deserves the same protection and care. And that voice of equity and inclusion was really her legacy, I think, as a secretary and as a human being in this work. Next slide. I pulled this from the post that was done by the Poison Center when Mary passed. And I want to just read a statement here that Dr. Phillips wrote about Mary. It says, our executive and as the executive and medical director, he shared these words: Mary worked, saved lives, and strengthened public health systems. It was her warmth, integrity, boundless curiosity, and truly set her apart. Mary believed in the power of listening, in learning from every voice in the room, and showing up, whether in the halls of government or out in the field inspecting restaurants, clinics, and shellfish beds. She inspired those around her to care more, try harder, and think bigger. In the pieces that the center did in a tribute to Mary, Mary was quoted there, and I think this captures a lot about who Mary is and is really a good segue into my stepping into the leadership of the Secretary of Health role. She says, I was thinking about my 40 plus years in public health and how many times we had the opportunity to reinvent ourselves to face the future. We have to keep looking to the future and make the changes and let go of the stuff we need to let go of. Evolutionary, changing, and meeting the challenges in front of us. Mary will be always remembered for her commitment, her integrity, and her fierce work in the work that has touched all of us. Next slide. So, new chapter. So I came into my role was announced in June and really stepped into the role about 4 weeks ago, as I noted, and carrying a lot of things in particular for Mary's leadership and others who have been before me. There have been let's see, 1, 2, 3, 4. I'm the 5th Secretary of Health for the state of Washington. And I did have the opportunity before Mary's passing to talk with her 2 or 3 times leading up to encouraging me to put my name forward for the position. Let me tell you a little bit about me if you don't know who I am, and why this is an important part of my journey here, being with you and the greater public health system and healthcare system in the state of Washington. I grew up in Eastern Washington in a small farming town called Othello. My parents met in high school there. In fact, they are still in the same house that I grew up with in Othello. And I'm the first in my family to go to college. And in the little town of Othello, when it comes to education, there are 2 groups of people who have college educations in particular. There are those who serve in the education system in our schools, and those who serve in the healthcare system within Othello. And as I looked to go to college, trying to figure out what I wanted to do, I knew education was probably not going to be my passion, and moved more towards the space of healthcare. I went to Eastern Washington University, got a degree in health services administration, and I graduated in 1993, and at the time was also coming out as a gay man in the HIV epidemic in our country, worldwide, and in particular in the state of Washington. Coming out into a community that was being devastated by an epidemic of disease, but also epidemic of stigma and a lot of hate. It was really important for me to feel like I wanted to lean in and do something to make a difference, and to show up in my community with a person from the community who was greatly impacted. I took my first role in Snohomish County, moved from Eastern Washington, and began working as a health educator in Snohomish County, and moved into the program management of that role, and was there for 12 years, very committed, and saw a lot of changes to our HIV epidemic during that time. I had a great colleague and mentor who was a physician who moved down to King County, encouraged me to broaden if I was going to stay in public health, and to branch out into other things within the public health system. I assured him that I was really not interested in public health. My mission was really about doing HIV work and working in the community. But after 12 years, I really did fall in love with the mission of public health, in really serving and raising the voice of people with lived experience in order to really bring about change that was needed around disease models, and really about equity and inclusion as a major part of the driver early in my years of public health. I ended up going down to King County, worked in TB program, working with refugees and immigrants and people living unhoused as a major force there, and then moved into a place moving into more of policy and community outreach and engagement to shift policy platforms for public health. My first public health policy was around menu labeling. And if you go to Starbucks or to any chain restaurant and you see calories posted, that certainly is an impact of that policy. We took that on with the city of New York, sued a couple times by our restaurant association, and later was successful, and then adopted under the Obama administration as a federal policy, and then provided some guidance for FDA for the implementation nationwide. Really believing that access to information is important for people to make decisions that are good for their own health, and really understood how the policy impacts could make huge differences in individuals' lives when it comes to their own personal health. I ended up moving into the deputy role in King County for a period of time, then followed in Inslee's administration with Secretary Weisman as his deputy secretary at the Department of Health for a few years, commuting down to Olympia and Tumwater community, and then ended up coming back to King County, where I oversaw the infectious disease programs, and then COVID happened, and was deeply involved with the commitment and response, as the first death in the United States was here in King County in the work that we were doing. Challenging times, lessons learned, difficult for many levels, from loss of life in our communities to vaccine, to the political battles and challenges around mental health, isolation, and a variety of other issues that really were faced, in an exhausted workforce and an overtaxed healthcare system as part of that area. During that time, our beloved director of King County Public Health stepped down and retired, and I moved into the director role for the remaining half of the COVID response for King County. Ended back up in Snohomish County as their new director, first director of their county health department, moved from an independent health district to a department, where I served most recently in really addressing opioids, overdose to action grants, and really doing community-led interventions to really make impacts to our community. Under the leadership of Executive Dave Summers up there, we had a multi-agency coordinating group to make sure that all the system was working together to really have an impact on accessibility to treatment, prevention strategies, and making sure we had good data that was available to our community to change the trajectory of this disease. I am now in this role 4 weeks and learning a lot, and will continue to learn a lot. Next slide. I'm not going to go into the slide, but I just want to kind of lay out. I'm beginning what we call our initial 100-day plan. Starts this week, where we'll be out again, kind of following the spirit of Mary, is being out in the community, understanding health from people who are either in the healthcare system or our public health system, and really trying to root ourselves in health justice, health equity, and strengthen our workforce in these particular areas. We'll be doing this for the next 100 days, our initial pieces. There'll be some quick ones we can identify and move changes, and then we will identify some longer term strategies for the first year. We'll be collaborating with a variety of sectors and people from our community and from our tribal health to be able to understand what some of those solutions might be, and that strengthens both our public health system, our healthcare system, with a focus on equity and a strong workforce in order to be able to deliver the work that we need to do. Next slide. I'm often asked in my first 4 weeks, as I've done media, what are some of the challenges that we are facing in our healthcare and our public health system. There are 2 things which I'm calling the convergence of funding and policy challenges that are of no surprise to all of you here today. We have at the state, we have a $12 billion deficit that is projected for the next 4 years. And we've had to see some reductions in our public health workforce because of some of these budget cuts, where legislators had to make very tough decisions, and no cuts were good cuts, and all had impacts both to the communities that we serve and the outcomes that we all desire for that align with our values as Washingtonians. The other cuts that we are starting to experience is the convergence of the policy decisions that are being made at the federal level that are having huge impacts both to our healthcare system and to our work in our public health infrastructure. And these are very concerning to me. And we need to move forward as a collective system to both advocate for policy change and to be able to move education and awareness so people really understand what some of these things are that are impacting us in the state of Washington. We're standing up what we call a readiness group to be able to plain talk some of these things. I think part of the chaos of all the executive orders that have come out is people have a hard time understanding what it means to me locally, what it means to me individually, and what it means to the work that we're committed to doing and the values that we have here in the state of Washington. Next slide. I want to give a couple examples of these. And when I'm thinking about my job as the Secretary of Health, I kind of bucket it into 2 areas, our healthcare work and our public health work. So I'm going to start with our healthcare piece. As you know, there was a reconciliation bill that was passed and outside of a typical process that really had devastating cuts to Medicaid in our country. In the state of Washington, what this means is if this is not changed or altered or adapted, these will have devastating impacts to access to health care in our system. 250,000 people in Washington are expected to lose Medicaid services once these cuts go into place. An additional 150,000 people will be priced out to the state's health exchange because of these match dollars that come in through the exchange that we have here in the state of Washington set up through Medicaid reimbursements, both state funding and federal funding combined, that makes it affordable for our lower income folks in our community. In the state of Washington, children will be especially impacted. We have about 800,000 kids statewide who rely on Medicaid. In some of the counties within the state of Washington, 90% of kids are enrolled in Medicaid. We also know that there will be adverse impacts to rural communities who are disproportionately affected by these cuts. You're starting to see in the media rollout the ones I'm reading say about 14 hospitals could be closed in the state of Washington. I have seen that as a range, 7 to 14, and there are a number of impacts to access to care, and in particular to our workforce, and will also have an economic barrier and burden on our state as a whole. As a person who grew up in Othello, and my parents in their mid-80s, they received their care in two places. At a critical access hospital in Othello that will more than likely be cut if these cuts go into place and closed. And the healthcare system there is a federally qualified health center. Private healthcare is no longer available there. It's all through a federally qualified health center. If these services are reduced or lost, this means that the next closest place that could be for my parents would be at least an hour's drive to an emergency room or an urgent care if something should happen. Earlier in this month, last month, my mom took a big fall, ended up having stitches, broke her hand, had to have orthopedic services. And I couldn't imagine what that would have been like to navigate if those services hadn't been available in the places that we really want my parents to age and age well in their own community that they know and supported by folks. Next slide. When we talk about who we serve in Washington under Medicaid, I've talked a little bit about the impacts of those numbers, but I want to just put a little bit more impact on who these people are and where they're at. Is 45% of the births in the state of Washington are born with parents on Medicaid services. 3 in 5 nursing home residents depend on Medicaid funding. 3 in 8 people with disabilities depend on Medicaid funding. And of course, opioid use disorder treatments for thousands depend on Medicaid funding for these services. Cuts threaten long-term care, disability services, and our behavioral health supports programs throughout the state of Washington. This is a very concerning development, and it will take collective strategies and advocacy and government and private sector and all of us to really lean in to change the trajectory of this devastation. Next slide. I want to talk a little bit about potential federal impacts on public health. These are, again, coming to the things that in my first 4 weeks that I'm getting a better understanding, and through our listening tours, we'll figure out how we respond as a system, as a community in this work. In the state of Washington, our public health, governmental public health system is 30% of our funds come from the federal government. Right now, what we're seeing in our work is about $100 million have already had abrupt canceling of public health grants. Now, some of these are in the court systems and waiting to see where we will land, if we'll be able to spend those dollars out. We've had some wins in the recent court cases around some of the COVID funding to implement programs and services based on what we learned during COVID to better serve our communities and protect them from disease. Currently, we are monitoring 40 grants that are up for renewal in the next 90 days that we've heard nothing from the federal government. And that's an additional $190 million that will be impacted by our public health system based on federal policy changes and what I would say are not the values of Washingtonians. Next slide. Want to give you a couple examples of what those 40 grants are, 2 examples of ones that we're monitoring and very concerned about. One is our Women, Infant, and Children Services, better known as WIC program, that is on the concern of not being funded or fully funded services to our most vulnerable people, mothers and children who have nutritional services. these are about 200 people of these services are provided in the state of Washington, and 153,000 of these are children. Half the babies born in the state of Washington are on WIC, or their parents are on WIC programs. The purpose of the WIC program, if you're unfamiliar with it, is really about serving moms and babies to really get off to a good start. Prenatal care, to nutrition while a pregnant mom, to delivery, and the nutrition education, counseling, and services to both mom and baby, so that we have positive effects on our birth outcomes. And we have fewer preterm babies that are born, which we know creates a healthy baby from the beginning. And it also ensures that children in Washington achieve their highest potential and are ready to start school. These are the things that we have had success and data to show the impacts of these programs in our communities that are on the cut from our federal government. And again, these do not align with the values that we have here in Washington. Next slide. Childhood vaccines have been at the epicenter of the federal government since COVID, and under the HHS secretary really being vaccine discriminatory, I will say, and a lot of false information that is coming out, and it's having direct impacts on our work in particular. Most recently, I want to talk about our MMR vaccines, our mumps, measles, and rubella. We have seen a resurgence of measles in our country. There were 10 confirmed cases in Washington state last year. And there were over 1,300 cases confirmed in the US in 40 states. We had 3 confirmed deaths. These are the first fatalities in over a decade that we have seen in our country. And this is after we declared in the United States in the year 2000 an elimination of measles because of our great immunization records and herd immunity within our country. We are really seeing this as a major impact and a loss to our public health gains over the last several years. Measles is just one, MMR is just one vaccine that we provide. There are a number of others that will have increased the burden of disease in our communities, overtax our healthcare system that is also under attack for our Medicaid services. And we have a lot of work to do in this particular area. Just as an example of what we're starting to see, it doesn't look like a huge shift, but in just the difference of a couple years, we have seen a trend starting to decline in our childhood vaccines. In our MMR vaccines in 2021, we went from 94.4% of all kids vaccinated going to school down to 92.7%, so trending in the wrong direction. What we do know is in order to obtain herd immunity and to protect our kids and elderly folks and others with immune compromises, is we need a threshold of about 95% of our vaccine rates in order to be able to get to that level of community immunity in our work. So we're under that currently at about 92%, and we've got that gap we need to close and change that path that we're on currently. So we have a lot of work around education, rebuilding trust around our vaccine, and looking at strong policies that move us in a different direction that really protects our kids and our vulnerable populations in the state of Washington. Next slide. To the context of this kickoff of your overdose work here as part of the work that you do in substance use and poison control, and work is one of the other federal grants that is in jeopardy right now. Is called Overdose to Action funds that we receive from the federal government. These in particular are funds that have helped us do a few things. One is that it has helped us enhance our surveillance, both on fatal and non-fatal overdoses. So we understand the impacts of overdose in our communities and how do we change those things in people's lives in order to be able to prevent premature death. We also have worked closely with and linked our emergency department records to have a better understanding in real time what is going on in our community. And we've had a focus on emerging threats of types of drugs in our community and getting those actions out there so that we can inform our public and our providers and our prevention services and our treatment providers in real time and how to really combat what we're starting to see in our overdose. Also, these funds have really led our community center intervention, a community-centered approach to our interventions, from our naloxone distributions to community-based organizations. It's been equity-focused and really working to reduce stigma in our communities. And so people will reach out and move into treatment when they are ready. But in the meantime, meet them where they're at and provide more of a harm reduction approach to getting people to better places. Next slide. So a little bit of data. So when you think about overdose deaths in the state of Washington, we fall behind the national trend, which we're starting to see a trending down of overdose deaths. We're lagging behind that in the state of Washington. As you will see in 2024, where the data is pretty much finalized, it's not quite fully there, but we had about 3,100 overdose of any drug in the state of Washington, which is lower than we saw in 2023, but as you can see, much higher than all the previous years before 2023. This is very concerning. This is it's a call to action about what we need to do to continue to not allow ourselves to be complacent in this work going forward. Every one of these numbers is a face. Is a story, is a family member, is a parent, is a child. And when we dehumanize by looking just at numbers, we are losing the impact of what this has on our communities and the people across our communities as a whole. I have a niece who suffered from heroin addiction. And if it wasn't for dedicated providers, people intervening at the right time, and continually bringing her the opportunities for treatment and treating her in a humane and seeing her own humanity and moving her in a direction over time, has become sober and is living day to day in a way of recovery that is with makes us grateful that she was not one of these overdose deaths. There are many, many stories of people who are impacted in our communities, and we have to really address not only the crisis of the disease, but we also have to attack the crisis of the stigma that is attached to these numbers. Next slide. I put this in here because I think it is such a good visual. When you think about 3,000 deaths in 1 year in the state of Washington, I have two pictures here of the Paramount Theater in Seattle, if you've ever attended. It seats 2,807 people. If we were to put the people we lost, if we were to have a representation of the people we lost in 1 year, it would be standing room only in this facility. It's a strong visual of how many people have been lost to this impact of this disease. Again, it's a call to action of what we need to do in ending stigma and centering our compassion in this work. We know that we have more to do. Next slide. I pulled this up here. This is, I won't spend a lot of time on this because it's not mine to share, but I just want to call out to the work of the Washington Poison Center that they are doing phenomenal work in this space in collaboration with many of you who are on this webinar today and this conference. In the celebration of what we call to action of what we need to do. I applaud them for the work that they have done around real time and expertise around emergency support, meeting people where they're at, providing caring, compassionate services in helping people to find treatment where needed and to help them triage emergencies and to reduce harm in the lives of people who call, either family members or individuals themselves who need help in a real moment, and they get a person to talk to really help them move this along. Dr. Phillips mentioned this earlier, the work that they've done around surveillance and data insights, around real-time data and offering immediate lens to emerging threats and supports to our community and response, incredibly impactful. And the public education and prevention, both to those impacted by the disease, providers, and families, is meaningful. And the collaborations at a system level impact, thinking about policy changes, funding, and working with partners in public schools and community organizations. It's very centered in their mission and around preventing and reducing harm and harm from poisoning to individuals, and to turn this chapter behind us on people who are dying of this disease in our state. Next slide. As mentioned, this International Overdose Awareness Day is coming. These series that are being provided by the center is leading up to our August 31st, 2025 date of our International Overdose Awareness. I'm just showing a couple slides here that we want to make sure that we are getting information out, accessible, and raising awareness throughout our communities and the work that we're doing. If events are happening across the state, please reach out. We will collect these, we will post these, we will get this information out. The theme this year is One Big Family Driven by Hope. And I think not only around the overdose awareness, but the other things that are confounding our challenges in this space around policies and funding are incredibly important call to action for all of us. Next slide. Here is just an example of what the Department of Health is willing to do, is to get your event and your activities posted here on maps and on our page to get more information out for folks to be able to attend. Next slide. And also want to acknowledge the Healthcare Authority has a toolkit. If you're not familiar with it, you can go to their website, download it in a PDF. And it's an overview of the overdose in Washington. And it's really how to promote local events and resource list of where you might get other particular support in the work that you're doing in this particular area. It's really one big family driven by hope. Is really an encouragement of everyone in the state of Washington that this is a call to action, our collective action, and what we need to do. Last slide. So I want to end in this slide because it's near and dear to my heart. I will tell you, in stepping into this role, and we talk about the legacy of Mary Selecky as we started this conversation, of her commitment to equity, her commitment to the healthcare system, in particular rural health, and her commitment to prevention and good public health services, in co-collaborating, creating cultures of belonging and inclusion, and sharing power, are all things that I carry with me into my role coming into this work. I was on a trajectory of retiring early and had a plan to retire early, and I want you to know that thinking back to my moments of early things that brought me to my work in public health to begin with was the HIV epidemic, as I mentioned earlier. We oftentimes, when I started in my public health career in Snohomish County, if you've not been to the Rucker building, is an atrium. And in that atrium, every Monday morning, we would come out and we would read the names of the people who died that week. Every week, people were dying of this AIDS crisis. And we placed a flower in the atrium as a reminder that those lives continue within us, and a call to action for every flower that was placed is something to do more to save the lives of others so that they would not fall to be a victim of this disease. This feels very remnant to our overdose work and several other areas of work in our public health actions. It's one that is based in a disease model. It's one that is riddled with stigma and one that needs the collective impact in order to be able to make the change collectively. I wanted to, I put a quote together that I'm using as my cornerstone as I start my role as a Secretary of Health, and that I want to leave with you today. In every crisis, public health doesn't retreat. Its roots deeper. Let this be the moment we rise, not because it's easy, but because our communities deserve a future built on truth, trust, and protection. The road ahead may be steep, but hope walks with purpose, and we walk together. So I look forward to serving the great state of Washington in this role. Big shoes to fill from great secretaries before, in particular Mary, and I know that in the spirit of Mary, that collectively we're stronger with our shared mission of improving the health, safety, and the quality of life for people who live, work, play, and reside here in the state of Washington. With that, thank you so much for the invite to be with you today.
Thank you so much, Secretary Worsham. That was a perfect quote, I think, to wrap this up. I found myself very moved throughout your speech there. Dr. Phillips, is there any last thoughts you'd like to share before I wrap up this opener for the day and remind folks of the next session?
Well, I think, it's important to recognize that Secretary Worsham and myself both grew up in Eastern Washington in small towns with critical access hospitals. And I think we're both connected to that part of the state. And we realize what a risk they're facing right now and what it means to the communities. And so it's really something we all need to work together as and work forward in supporting. And I'm, as always, an optimist. And so let's work hard, and I'm looking forward to more things that come ahead. So thank you, Secretary. I appreciate it.
Thank you so much.
Wonderful. Thank you, Dr. Phillips. Thank you, Secretary Worsham. So folks who are still on the stream, still listening to the stream, our next session will start at 10:30 a.m. This is all on crowd control agents with Dr. Suki Etty. So please join us for that. Use the time in between to load up on some more coffee or tea, maybe grab a snack. And please engage through Whova. Feel free to ask questions on the various aspects of the platform there. And I look forward to seeing all of you and hopefully more in our next session. Thank you very much, everyone. Take care.